Hello friends, today we are going to talk about water soluble vitamins, their physiological role, bioavailability, sources of water soluble vitamins, deficiencies and excess of water soluble vitamins. The objectives of today's topic are to enable all the students to understand the classification of vitamins, water soluble vitamins, their role in human health, and also to understand about the importance of bioavailability, sources of water soluble vitamins and the excess of water soluble vitamins. Coming to the introductory part of vitamins, vitamins are among the most essential nutrients which are found to be exclusively essential for life. Unlike other classes of nutrients, vitamins serve no structural function nor do they provide any significant energy to the body. Their various uses tends to be very highly specific. Common food forms of most vitamins require some metabolic activation into functional form or active form. Although vitamins share these general characteristics, they show few close chemical or functional similarities. For example, some vitamins functions as coenzymes, others function as antioxidants, and two other vitamins like A and D functions as hormones. 14 substances are now recognized as vitamins. Vitamins are frequently described according to their solubility. They may be either fat soluble or water soluble. This method of classification dates back to the history of their discovery as labeled by McCollum as a fat soluble vitamin or water soluble vitamins. In today's session, we are going to deal about water soluble vitamins. The first vitamin we are going to look at is thiamine. It is also called as vitamin B1 and this was the first vitamin to be identified. In modern times, thiamine deficiency is seen most commonly in association with only chronic alcoholism. Only a small percentage of large doses are absorbed and elevated serum levels result in its active urinary excretion. After an oral dose of vitamin, peak excretion occurs in about 2 hours. Total body thiamine content in adults is approximately 30 milligrams with a half-life of 9 to 18 days. The recommended dietary allowance for thiamine is between 1.2 and 1.7 for men, 1 and 1.4 for women, with an increase of 0.2 milligrams per day for pregnant women and an increase of 0.3 milligrams per day in lactating women. It should be noted that increased needs exist in persons being treated with hemodialysis or peritoneal dialysis and individuals with malabsorption syndrome, women carrying more than one fetus and women nursing more than one infant. There are no reports of adverse effects of consumption of excess thiamine consumed in food or supplements. No upper level can be set due to lack of reported findings associated with adverse effects. Supplements that contain up to 50 milligrams per day are available over the counter with no reported problems. Vitamin B1 deficiency leads to a condition called as beriberi, characterized by excessive fatigue or muscular weakness, loss of appetite, vague aches and pains or tingling sensations, loss of sensation or numbness in hands and legs. Severe deficiency can cause nerve damage leading to paralysis of leg, heart abnormalities such as palpitations or enlarged heart, lung congestion and difficulty in breathing. Gastrointestinal disorders such as indigestion or constipation, Crohn's disease, recurrent canker sores, stunted growth, forgetfulness or mental confusion, nervous irritability or mental depression, vague fears or feelings of persecution. Severe deficiency of thiamine can lead to brain damage and a form of dementia also. Coming to the food sources of thiamine, the thiamine rich foods include enriched, fortified or whole grain products such as cereals, bread, chapati, bread products, mixed foods that contain grain and ready to eat cereals. Foods that are especially rich in thiamine include yeast, lean meat and legumes. Thiamine is absent from fats, oils and refined sugars. Milk, milk products, seafoods, fruits and vegetables are not good sources of thiamine. Coming to the next water soluble vitamin, riboflavin, which is also called as vitamin B2. This was the second vitamin discovered and it was named vitamin B2 or riboflavin. Most dietary riboflavin is consumed as a complex of food protein. Signs of riboflavin deficiency are sore throat, redness, edema of throat, oral mucous membranes, chelosis and glossitis. Vitamin B2 deficiency most often occurs in combination with other nutrient deficiencies. The B vitamins are quite interrelated. For example, niacin requires riboflavin for its formation from the amino acid tryptophan, and vitamin B6 requires riboflavin for conversion to active coenzyme form. The required dietary allowances of riboflavin for men are anywhere between 1.4 and 2.1. For women, it is between 1.1 and 1.7 with an increase of 0.3 milligrams per day in pregnant women and 0.4 milligrams per day in lactating women. When riboflavin is absorbed in excess, very little is stored in the body tissues. Excess is excreted via the urine and the amount varies with intake, metabolic events and age. No adverse effects associated with riboflavin consumption from food or supplements have been reported. Vitamin B2 deficiency symptoms include dermatitis, peeling of skin around the nose, cracks or sores at corners of mouth or lips, swollen or sore throat, shiny red, purple or inflamed sore tongue, loss of sense of taste, loss of appetite, damage of fetus during pregnancy, anemia, nervousness or irritability or depression due to nerve damage. Eyes also does get affected with vitamin B2 deficiency with burning or itchy eyes. The greatest contribution of riboflavin from diet comes from milk, milk products and milk drinks, followed by cereals, bread products and fortified cereals. Especially good food sources of riboflavin are eggs, lean meat, milk, broccoli and enriched breads and cereals. It is important to note that riboflavin loss occurs when it is exposed to light and therefore it is advised to store milk in opaque containers or away from light because milk is a very good source of riboflavin. Coming to the third water soluble vitamin, niacin. The term niacin refers to nicotinamide and nicotinic acid. The coenzymes, the active form of niacin in the body, are synthesized in all the tissues of the body. The amount of niacin in the body is the result of absorbed nicotinic acid and nicotinamide as well as conversion of amino acid tryptophan. Excess niacin is always excreted through the urine. Pellagra is the classical manifestation of niacin deficiency. Pellagra has been seen in areas where corn is extensively consumed and where corn is a staple food. Enrichment and fortification of grain has virtually eliminated pellagra from the countries like United States and Europe. Niacin deficiency symptoms include dry, cracked and scaly skin, pellagra, which is a condition characterized by dermatitis, diarrhea and dementia, feeling of lassitude or weariness, muscular weakness, loss of appetite, indigestion or gastrointestinal disturbances, depression, irritability, anxiety or confusion. Severe deficiency can cause severe dementia. The required dietary allowance for Indian men for niacin is 16 to 21 milligrams per day, whereas for women it is 12 to 16 milligrams per day. For pregnant women it increases by plus 2 milligrams per day and for lactating women it increases by plus 4 milligrams per day. Niacin given as nicotinic acid in doses from 4 to 6 grams per day is one of the oldest drugs used in the treatment of hyperlipidemia, which consists of elevated blood levels of triglycerides and cholesterol. Niacin lowers the low density lipoprotein cholesterol and triglyceride concentration. This therapeutic effect is not seen with nicotinamide. nicotinic acid in therapeutic doses can cause flushing and headache in some people. These side effects are not harmful. Dietary intake of niacin comes mainly from mixed dishes containing meat, poultry or fish, followed by enriched and whole grain breads and fortified cereals. Significant amounts of niacin are found in red meat, liver, legumes, milk, eggs, alfalfa, cereal grains, yeast and fish. Then coming to the next water soluble vitamin, that is pantothenic acid. Pantothenic acid was named after the Greek word meaning from everywhere because it is so widespread in foods. Pantothenic acid is essential in the diet because of the inability of animals and humans to synthesize the pantoic acid moiety of the vitamin. Pantothenic acid plays a primary role in many metabolic processes such as oxidative metabolism, cell membrane formation, cholesterol and bile salt production, energy storage and activation of some hormones. Pantothenic acid deficiency in humans is rare because of its distribution in the foods. Many health claims are made regarding the role of pantothenic acid in ameliorating rheumatoid arthritis, lowering cholesterol, enhancing athletic performance and preventing graying of hair. No reports of adverse effects of oral pantothenic acid in humans have been reported. The required dietary allowances for pantothenic acid of 5 mg per day for adult men and women, 6 mg per day during pregnancy and 7 mg per day during lactation. Vitamin B5 deficiency symptoms or pantothenic acid deficiency symptoms include numbness and shooting or burning pains in the feet, chronic fatigue, depression or irritability or listlessness, rheumatoid arthritis, headaches, nausea, insomnia, abdominal cramps, increased susceptibility to colds or infection. Because of its thermal liability and susceptibility to oxidation, significant amounts of pantothenic acid are lost during processing. Rich food sources of pantothenic acid include chicken, beef, liver and other organ meats and whole grains, potatoes and tomato products. Coming to the next vitamin, that is vitamin B6. Vitamin B6 is a coenzyme for more than 100 enzymes involved in the metabolism of amino acids, glycogen and nerve tissues. Microcytic anemia reflecting decreased hemoglobin synthesis can be seen in the deficiency states. The interaction of B6 and folate has been shown to reduce the plasma concentrations of homocysteine and decrease in the incidence of cardiovascular diseases. Subjects with highest intake of folate and vitamin B6 have a twofold reduction in cardiovascular diseases as compared to the groups with lowest intake. The required dietary allowances for vitamin B6 or pyridoxine for adult men and women is 2 mg per day, whereas for pregnant and lactating women it is 2.5 mg per day. No adverse effects have been associated with intake of vitamin B6 from food. However, large doses of vitamin B6 or pyridoxine used to treat carpal tunnel syndrome and premenstrual syndrome have been associated with sensory neuropathy. These findings were noted with dosages from 2 to 6 grams per day. It appears that the risk of developing sensory neuropathy decreases quite rapidly at dosages below 1 gram per day. Thus, the upper limit for the adults is set at 100 milligrams per day of vitamin B6 as pyridoxine. Pyridoxine deficiency or vitamin B6 deficiency symptoms include skin disorders such as eczema or dermatitis, cracks or sores on lips or mouth, inflammation of mucous membranes of the mouth or tongue, nerve related problems including convulsions and seizures, arm and leg cramps or numbness of hands and feet, irritability or mood abnormalities, depression, nausea, dizziness, migraine headaches, anemia or chronic fatigue or muscle weakness, increased susceptibility to infections and asthma are some of the vitamin B6 deficiency symptoms. Coming to the food sources of vitamin B6, the good sources of vitamin B6 are whole grain cereals, legumes, fortified ready-to-eat cereals, mixed foods with meat, fish or poultry as the main ingredient, white potatoes, starchy vegetables, non-citrus fruits. Vitamin B6 is widely distributed in foods and good sources are meats, whole grain products, vegetables and nuts. Coming to the next vitamin, that is folate. Folate is a B vitamin that exists in many chemical forms. Folic acid, the most stable form of folate, occurs rarely in food but is the form used in supplements and fortified food products. Folate coenzymes are involved in numerous reactions that involve DNA synthesis, purine synthesis and amino acid metabolism. The most well known is the conversion of homocysteine to methionine. It is this recent reaction that reduces the concentration of homocysteine in the plasma and may lower the risk of cardiovascular diseases. The metabolic interrelationship between folate and vitamin B12 may explain why a single deficiency of either vitamin leads to the same hematological changes. In either folate or vitamin B6 deficiency, megaloblastic changes occur in bone marrow and other replicating cells. Pregnant women are at risk for developing folate deficiency because of the heightened demands imposed by increased synthesis of DNA. Low folate status is associated with poor pregnancy outcome, low birth weight and fetal growth retardation. Because of the possible incidence of neural tube defects during the pre-conception period, it is recommended that women who are capable of becoming pregnant should consume 400 milligrams per day of synthetic folic acid derived from dietary supplements or fortified foods in addition to their usual dietary intake. Neural tube defects are the most common major congenital malformations of the central nervous system. Recommendations for intake of folate are dependent on variations in bioavailability. Supplemental folate is nearly 100% absorbed, while absorption of folate is found in foods to only about 50%. Fortified foods approach the level of bioavailability of folate found in supplements. This has led to the term dietary folate equivalents. The required dietary allowances for dietary folate is 200 milligrams per day for both adult men and adult women. During pregnancy, the dietary folate requirement is 500 milligrams per day, whereas during lactation, the folate requirement is 300 milligrams per day. No adverse effects have been associated with consumption of normal folate fortified foods. Folic acid deficiency symptoms include megaloblastic macrocytic anemia characterized by breathlessness, heart palpitations, insomnia, irritability, forgetfulness, lethargy, stomach disorders, pallor, sensitivity to cold, chronic muscular fatigue or general weakness, which affects the production of neurotransmitters leading to symptoms of irritability, hostility, non-senile dementia, confusion, insomnia, mental fatigue, depression and nervous system problems of hands and legs. You can also see symptoms like skin disorders like seborrheic dermatitis, vitiligo and gastrointestinal problems like periodontal disease, gingivitis, mouth and peptic ulcers, digestive upsets, swollen or smooth red tongue, cervical dysplasia leading to greater risk of cervical cancers. Apart from this, you can see other symptoms of folic acid deficiencies like premature graying of hair, higher blood levels of homocysteine and risk of heart diseases. Deficiency can slow overall growth of the infants and children. Low birth weight or premature infants and neural tube defects also are result of folic acid deficiency in pregnant women. Coming to the folate sources in foods. Folates are found in nearly all natural foods. Protracted cooking or processing may destroy the folate. Foods with highest folate content include yeast, liver, other organ meats, fresh green vegetables, some fruits like oranges, etc. Coming to the last vitamin B, that is vitamin B12 or cyanocobalamin, which is a compound we call as vitamin B12. This is the only B12 preparation which is used in supplements An adequate supply of vitamin B12 is essential for normal blood formation and neurological functions. The absorption of vitamin B12 is dependent on several physiological steps in the stomach. Food-bound vitamin B12 is dissociated from proteins in presence of stomach acid. Vitamin B12 then binds with the protein and in the intestine. Vitamin B12 binds with the intrinsic factor for absorption. If there is a lack of sufficient acid in the stomach or intrinsic factor in the intestine, malabsorption occurs, which results in a condition called as pernicious anemia. The anemia of vitamin B12 deficiency is indistinguishable from the one which is seen with folate deficiency, because up to 30% of people older than 50 are estimated to have atrophic gastritis with low stomach acid secretion. Older adults may have decreased absorption of B12 from the foods. Therefore, it is recommended that most of the vitamin B12 consumed by adults greater than 51 years of age should be obtained from fortified foods or supplements. The required dietary allowances for Indian men and women for vitamin B12 is 1 mg per day, whereas it is 1.5 mg per day for pregnant and lactating women. There are no adverse effects which have been associated with excess intake of vitamin B12. Vitamin B12 deficiency leads to pernicious anemia, which is a condition characterized by pernicious anemia, characterized by fatigue, weakness, diarrhea, weight loss, pale skin, sore red tongue, hypotension, loss of appetite, nerve damage symptomized by tingling and numbness in hands and legs, loss of balance, unsteady movement, heart palpitations, confusion, disorientation or hallucinations, irritability, depression or other mood disturbances. The other symptoms of vitamin B12 deficiency includes memory loss, dementia, Alzheimer's diseases. Vitamin B12 is present in all forms of animal tissues. It is not at all present in the plants and therefore it does not occur in fruits, vegetables or any plant foods. Because the intake of animal foods is very low in Indian diets, B12 deficiency is very commonly seen in Indian people. People who avoid eating animal products may obtain most of their requirement through fortified foods. Then coming to the next vitamin, vitamin C. It is also called as ascorbic acid, which is a potent antioxidant in the animals and plants. Vitamin C is important in synthesis of collagen. Some evidence indicate that vitamin C reduces the viral activity by increasing the viral replication. Many anecdotal reports support a role of vitamin C supplementation to reduce the severity of cold symptoms. Non-heme ion absorption from food is enhanced 2 to 3 folds in the presence of 25 to 75 milligrams of vitamin C, presumably because of the ascorbate induced reduction of ferric ion to ferrous ion, which is less likely to form insoluble complexes in the intestine. However, vitamin C has no effect on increasing ion absorption from heme ion. Unlike most animal species, humans lack the ability to synthesize ascorbic acid. Therefore, the diet is the sole source for vitamin C. The dietary recommendations of vitamin C for Indian men and women is 40 milligrams per day, whereas it is 60 milligrams per day in pregnant women and 80 milligrams per day for lactating women. The upper limit for vitamin C was set as 2 grams per day. This level was set as a guideline for people using dietary supplements and was based on reports of gastrointestinal symptoms reported when too much vitamin C was taken. Vitamin C is very essential for synthesis of collagen, and shortage of vitamin C leads to scurvy. Other vitamin C deficiency symptoms include easy bruising and small spots of bleeding under the skin, swollen or painful joints or bones, slow healing wounds, fractures, nosebleeds, spongy, swollen and bleeding gums, loosened teeth, teeth decay, dry brittle hair, dry, rough and scaly skin, anemia, fatigue, lethargy, muscle weakness, loss of appetite, recurrent colds and infections, atherosclerosis also. Almost 90% of vitamin C in the diet comes from fruits and vegetables, with citrus fruits, tomatoes, tomato juice and few leafy vegetables being the major contributors. It is also added to some processed foods as an antioxidant. Among the Indian foods, amla is the richest source of vitamin C. Coming to the next vitamin, biotin. In mammals, biotin serves as a coenzyme for reactions that control such important functions as fatty acid metabolism and gluconeogenesis. Biotin is recycled upon degradation of enzymes to which it is bound. Biotin from pharmaceutical sources is 100% bioavailable. Deficiency is rare but has been seen in patients on parenteral nutrition without biotin supplementation. Lipoic acid and biotin have structural similarities, thus competition potentially exists for intestinal or cellular uptake, which may be of concern in settings where large doses of lipoic acid are administered or taken as supplements. Biotin intake for adult men and women is prescribed as 30 mg per day, whereas it increases during lactation to 35 mg per day. Deficiency of biotin is rare because it can be produced in the intestines from the food. Vitamin deficiency symptoms may include brittle nails, brittle hair, thinning of hair, hair loss, dry scalp, etc. No adverse effects of biotin have been reported. Toxicity has not been reported in patients receiving up to 200 mg orally daily or up to 20 mg intravenously. Biotin is distributed widely in natural foods. Those rich in biotin include egg yolk, liver and some vegetables. Coming to the last water soluble vitamin, that is choline. Choline has been considered a non-essential nutrient because humans can synthesize sufficient quantities. However, when hepatic function is compromised, hepatic choline synthesis is decreased and thus choline is now considered as conditionally essential. Choline deficiency symptoms include impaired fat metabolism and transport, which is symptomized by decreased blood levels of very low density lipoprotein that the liver uses to transport fats. Fatty acid buildup in liver, which may lead to liver damage, cirrhosis or fatty degeneration, raised levels of cholesterol or triglycerides, high blood pressure, high levels of homocysteine leading to increased risk of heart diseases. Choline functions as a precursor for phospholipids and acetylcholine and betaine. The recommended dietary allowance for adult men was set at 550 mg per day and for women it is 425 mg per day. During pregnancy, it increases to 450 mg per day and during lactation, it further increases to 550 mg per day. To conclude the water soluble vitamins, we have seen all the different kinds of water soluble vitamins like thiamine, riboflavin, niacin, pyridoxine, vitamin C, choline and biotin. All the water soluble vitamins are very essential for human health maintenance and no excess amount of water soluble vitamin is stored in the body because they are naturally expelled outside the body. The sources include different kinds of foods like cereals, vegetables, meat and meat products. Thank you.